This is Akulina. You are watching Coffee with Lina podcast. Today my guest is a skilled orthopedic physiotherapist.
Injured suddenly in accidents or damage can occur slowly due to repeated movements or poor posture. Fibers compresses blood vessels and decreases their blood supply, leading to oxygen starvation and the accumulation of waste products. This irritates nerves and causes pain. Activated pain receptor.
Hi, I'm Dr. Shilpa from Kerala. I'm an orthopedic physiotherapist and I've been in this field since past 15 years.
Physiotherapy aims to reduce and eliminate all forms of pain, physical dysfunction or injury that a patient may present with.
Sometimes I see many people are living for a long time here. You are telling that 9 years you are here. So what are the similarities you can find out in Vietnam, what you have seen in Kerala?
Yeah, of course, the climate, which is very similar to Vietnam, the climate in Kerala is very similar to Vietnam. And all the greeneries, very beautiful places. These are the similarities that I find.
And what are the differences?
Difference, of course, the way people greet and meet each other, and the nightlife, which is definitely not I cannot see in Kerala. Yes,
It's
the
in
nightlife. Okay.
Yes.
Okay.
Anyway, so what is orthopedic physiotherapy?
Okay, orthopedic physiotherapy is a specialized branch in physiotherapy. In this, we mainly focus on the musculoskeletal conditions. That is the joints, muscles, the ligaments, the tendons. These are the main focus. And in this, we use some modalities and mainly the manual therapy, that is with our hand, and the exercises to treat the patients, and it will help them for the speedy recovery.
So where did you get the inspiration for pursuing this orthopedic, like physiotherapy?
Yeah, I should go back to my childhood actually, because when I was very young, I had an issue of knock knees. That is, in medical term, we call it as genu valgum. So at that time, my parents used to say like, this can be treated by a physiotherapist. So that's how the term that entered into my brain. So when I reached the 12th grade, I started to search more about the profession. Then I understood the scope and the goal of what a physiotherapist should be, like how they work. So I got some interest into that, and yeah, that's the inspiration in me.
So I heard this word also first time, knock knee. What is that?
Oh, okay. So knock knee is a condition in which the knee joint, knee joint will be closer to each other, and the jaw and the bone above to the knee joint and below to the knee joint will be apart from each other. So it's basically in this way.
So what is the right posture? Like what is the right
Right
should
posture?
be the right thing?
Yeah, right posture means the bone and joint should be aligned in a line. Okay, so genu valgum is a condition. It is like this. Okay, there is another condition called as genu varum that is opposite to this. That is bow legs. Yeah.
So what was the problem of you like that time? What kind of problem did you face?
Actually, I didn't face a lot of problem, but appearance wise, I didn't feel that good. But it's very quite normal. We cannot see perfect human beings, right? So this happens.
This happens. It's a very common thing. Okay, so I heard from that you have done BPT and MPT, right?
Yes.
And so when did you start your journey and where? The real life journey.
Okay. So I did my BPT in 2000, started from 2012, and MPT from 2018 in the Rajiv Gandhi University of Health Science. Yeah, and I did it in Mangalore. And the real life journey, that is treating the real patients, that I started from 2015. Yes.
So you moved to Vietnam later on, right?
Like I was coming and going by the time,
By
because
the
my
time.
husband is working here, was
Yes.
working here now also. So I used to just go and
Going and
Yeah.
coming. So did you search for the job in Vietnam?
Yeah, I did search for job after my post graduation. I did some futile search for many years. I could say like it was very difficult to find a job in Vietnam.
So why? What do you think? What is the market in Vietnam for the physiotherapist?
Well, I could say that these people are really fit, and they do much more workouts and gym, aerobics, every kind, Tai Chi, everything. They do
Yes,
everything
Pilates.
for their muscles and for well-being. And if they get some kind of pain, they suddenly go to the massage therapist or the massage center, so they get a balance. So like they do, when they get pain, they go to the massage, and they, when their muscles are weak, they do the exercise. So that's
That
why
you
I
are
can
right.
say.
That I have seen many people. They are really fit, and
Yes.
whenever I feel lazy to walk outside, that time I see they are running, they are jumping, they are skipping, they are
Yes.
playing badminton. A lot of works.
Yes.
Okay, I'm sometimes afraid to see them. We cannot do that like that.
Okay.
But the thing is, I go for the massage also. I have been addicted to massage. So does it, like, what is your opinion about this?
To be frank, massage can be done once in a while. There is no issue in that. But if you do it constantly for many times, couple of times, like sometimes weekly one massage, that I won't recommend, because in massage, what happens is that you will lose the elasticity of your muscle. So again, what you are making is the muscles, when you get weak, your joints will be weak. Okay, so you need to strengthen it. That is very important. So just going for massage for just a
Monthly
temporary,
once?
yeah, just for temporary pain relief, I won't recommend. And monthly wise is once is okay, just for stress relief.
Yes,
Yes.
definitely it's a stress reliever,
Yes.
but I didn't know the side effect of this. Now I'm afraid. Now I'm really afraid. Okay. You are a certified pelvic floor rehab therapist, right?
Yes.
Can you shed some light on that?
Yes, pelvic floor rehab therapist is a specialized, again, a specialized area in physiotherapy. We mainly focus on pelvic pain, and in the patients, those who have stress incontinence, the urinary incontinence. And the other important thing is the postnatal care, like where the women's, they become very weak after delivery, so, or sometimes they become obese after delivery. So we work on these areas.
Oh, so I see many people when they are getting older, they go to the washroom many times. So
Yes,
this is the
yes.
reason for this
Yes,
one.
of course, yes.
But we didn't know that.
Oh, okay. This is the reason for that, because they have weak pelvic floor muscles, and sometimes they will be having the, the vagina. It start the uterus. It starts to come down. Because of the weak muscles. This happens because of weak muscles.
So how can we prevent that?
This can only be prevented with pelvic floor strengthening exercises, and the other way is surgical method. That is, when the uterus starts to come down, there is a surgery called as hysterectomy, where you remove the uterus. Yes,
I know about that. Yes. So you are also a certified dry needling therapist, right?
Yes.
So what's the procedure? Isn't it scary?
No, definitely no. Actually, in dry needling therapy, we use a very thin needle. Just it's very thin. Okay, and
Like the normal needle?
No. Normal needle is
Thinner than that one also?
Yes, it's very thin than that. And we insert it to the muscle. Mainly we focus on the muscle trigger points. That is, we get muscle nodes, okay, in the bulk of the muscle. So we poke that trigger points, and in that case what happens is that the blood supply increases to that area, and it sends a symbol or signal to the nervous system, and the natural painkillers are released in that area. So in that way there will be pain relief.
So instead of taking medicine, you can treat this way.
Definitely.
Okay.
But there are some risk factors, of course. But in some areas we cannot treat, but in most of the muscles we can use this dry needling.
Okay.
Yes.
So I knew about the wet needle only. Now I know. Yeah. Now I came to know about dry
Okay.
needling too.
Okay.
So
fine.
what kind of patients need the needle therapy?
Needle therapy can be taken by patients, those who have muscle pain. For example, those who have pain on their neck, that is the trapezius. You know the trapezius muscle here. So those patients can go for it, or for the deltoid. Again, for the hip muscles, the hamstring muscles, or the of course the calf muscle. Most of the people get night cramps. For them it's very effective.
Oh, I
Yes.
had the night cramps when I was
okay.
young. Yes.
Okay, that's very
For the
effective.
growth pain, I don't know what's the reason. Anyway, what are the 3 suggestions as an orthopedic physiotherapist for people?
3 suggestions. The first one is movement. People should move a lot. They should walk a lot. That is the first most thing. Then second thing is that we must focus on our posture, which is very important thing. We don't know like how we sit, how we walk. So that is another thing. And the third thing is the pain. So pain means it is a signal for something that's going wrong inside your body. It's like just consider it as a red flag. So these are the 3 points. Yes.
So now it's a rapid fire round.
Okay.
Stretching or strengthening?
Oh, stretching or strengthening. Okay, so I should definitely say this because I cannot isolate one. Both should be going together. But if you do strengthening, then there must be a stretching exercise.
Wow.
Yes.
One body part people neglect the most.
Oh, that is the core muscle. The core muscle, most of the people think that it is just the abdomen muscles. It's definitely not like that. The core muscle is way starting from your chest. That is the diaphragm. It starts from the diaphragm. Then we have deep muscles inside the abdomen, okay, that maintains the posture. Then we have the normal upper muscles that that 6-pack muscles. Then the hip muscle, then the back muscle, then of course the pelvic floor muscle.
Then I have to note down all the things I forgot within 5 minutes. So, but one more thing, when you were talking about the posture, I feel I am not really the person who maintain the good posture, but I learned from Vietnamese people, they really sit straight.
Yeah.
And we are maintaining the same now
Yes,
for doing
of course.
podcast. So it's a little chance for me to
Yeah.
maintain this one.
It's a bit challenging.
Yes, challenging. On one habit that is silently damaging our body.
Oh wow, this we all know, that is the sedentary lifestyle and the bad posture, like always scrolling the mobile phones or sitting in front of the laptop. These things are these.
Okay, so be
Culprit.
careful about that.
Yes.
One quick tip for the people who sits 8+ hours.
8+ hours, so definitely they will be having back pain. So the main tip I can give them is stretch your muscle. Like whenever you get time, just stretch your hamstring muscles. Like whenever there is a break time, do that. Yes, definitely.
In between, okay.
In between.
One exercise everyone should do daily.
Walking. You have to walk.
How many kilometers?
Okay, I can say that if you're a healthy healthy person, then you may have to take at least 10,000 steps a day.
I have never done that.
Okay.
And I don't think I can do it
you can
in my
start
lifetime.
from today. No, you can.
But I hear this from the ladies who are here living in Vietnam. They try to reduce their weight because it's a pressure, societal pressure from the Vietnamese people, they are always slim and trim.
Yeah.
But we are not. We are not.
Yeah, definitely.
Okay. So definitely Shilpa has shared insightful.
Yes.
information with all of us, but the most important thing is guidance, the right guidance. Whenever you feel pain, rather than searching Google, I also search Google for
Yes.
getting the relief from my mother, but now I'm thinking, okay, better to go to the doctor. Doctor is the right person. And next is your awareness. So
Yes.
you should be aware about your posture and your healthy lifestyle, and stay away from the sedentary lifestyle. And number one is, if you want to stay away from the medicine, then definitely focus on movement.
Yes, definitely.
Otherwise, no option.
No option.
Yes. So which one will you choose? Think about this.
Yes.
Medicine or movement? Think that you have got something beneficial from our discussion. Like, share and subscribe my video.